We are back with Dr. Todd at That Medical Spa, and if you are online right now, you actually can Google it. What is the exact address that everyone can go visit? So if they're in the tri-state area,
it's fountainmedicalgroup.com.
Wonderful. So you guys can check that out, and if you happen to be in the tri-state area and have medical inquiries or you need a day at the spa, you can go visit there, and Dr. Todd and his wonderful staff will assist you. Now, going back into our discussion regarding your medical expertise during the MLB Steroid trial, you do know a lot about steroids. That's something that we were discussing. From the ban, you said like the Olympics were ahead of their time. They had the ban, how many years ago did you say they expanded it?
The Olympics started in 1976. That always became like the gold standard for testing.
So why the delay with the MLB? Was it because people knew that this was going to help their team and they didn't want to kind of bring attention to this?
I mean, probably a lot of that was they had a strike in the late 90s, and then baseball had a big home run surge with McGuire and Bonds and everyone else, and a resurgence of the league really after that. So I guess no one really wanted to rock the boat until they were forced to do so, which it took an act of Congress, literally an act of Congress, to get them to start testing and enforcing a policy. They had a lot of other banned substances, but they really had no control over it, or really, and that's also because baseball players, Major League Baseball Players Union, is one of the strongest unions that were, and they really thought it was the Players' Privacy Act that they were playing upon as a reason for not testing.
Now, as a medical expert, do you have to have a confidentiality clause? Can you not really discuss what was going on, or because some of this was televised, that was kind of out the window and you were able to openly discuss what was happening after the trial?
What I testified on was purely the medical facts and statistics and relevancy, so it wasn't really testifying on specific people or specific cases.
And I guess that was good for you, because you're thinking, I don't want to get in trouble with, let's say, Joe Schmo. And Joe Schmo could be like one of the Jose Canseco people or something.
Right. And the difference in the 2008 hearings, which was on human growth hormone and B12 and other performance-enhancing drugs, is what the Mitchell report was, a report that looked at baseball and really dug up names and information on people and things like that. And so when we were called to testify at that hearing, a little concerning about if they were going to ask individual comments. But once again, they kept it really objective and specifically on medically related questions and risks and dangers.
Going into the MLB Steroid trial to then going to the UFC, something that you recently got passed and legalized in New York State.
Well, hopefully soon.
Hopefully soon. Well, can you discuss that a little bit of what role you're playing in this?
I was asked to go to Albany to meet with several different senators and assemblymen, with some members of the UFC, with Dana White, Renzo Gracie, Frankie Edgar, Lorenzo Petitas, Mark Ratner. We met with several different legislators in the Assembly and the Senate, and Steve Cohen, the Chief of Staff for Governor Cuomo, about concerns, questions they had about why we can't get MMA, mixed martial arts, approved in New York State. I was there as the medical expert to testify to the safety of all their new rules they have, their new head trauma regulations, which is the strictest policy in professional sports. And what recently started last week was them providing health insurance to all fighters in the league. So I think the UFC has really shown to be a class and regulated and a serious sport to be reckoned with, not only financially, but also taking care of their own fighters.
Now, why is it that the UFC, although legalized in other states, has had such a hard time coming to New York? I mean, obviously, this is one of the most popular sports that we have going right now in the United States and even overseas. So why are we late to the party? What are the main concerns? You said head trauma.
Yeah, I mean, head trauma is always a big concern with boxing and with other contact sports in general, like football's looking at their helmets, just like baseball this year looked into their helmets. The UFC regulations now are very strict with any kind of head injury, 90-day suspension where you can't even have contact during practice. They have strict physical testing before and after every fight. They really have great policies. Originally, maybe 10 years ago, in the beginnings, it was marketed more as a blood sport, and because it can be bloody, you get a lot of lacerations. It may have that appearance to a person who's not familiar with the sport itself, but a lot of the sport is spent on the ground, wrestling, grappling, Brazilian jiu-jitsu, and not a lot of time is necessarily always spent just with striking. So there were concerns about the safety, the promotion of violence was the major objection, and really there were very few people who we spoke to individually who said no one really said they were against it. There was just no one on the floor to bring it to the table to really get it passed.
So why did they choose you as an advocate for this? Because I know that they approached you, obviously, with your medical background and your sports medicine expertise, but why did you feel like this was something that should be legalized?
Well, I've worked boxing since 1999, ringside fights at the Garden to Golden Gloves. I've worked at Muay Thai fights. I've taken care of several guys who fight in the UFC, past and present. I've had the pleasure of taking care of them. I've trained and worked out with these guys too. I have a great knowledge of the sport. So I felt it was, it was my honor to be invited to speak on that behalf as the medical expert.
So from being a medical expert, you ended up creating a Fountain Medical Spa, and that's interesting because it's a medical center, number one, you have physical therapy in there, but also there's this whole other aspect of really treating the external as well to treat the internal. How did you decide to do this? Why a spa? Why a medical center?
Well, I left a group that was purely just pain management and sports medicine and opened my own facility with my partner, Dr. Goldstein. And we had this idea for a long time about a complete wellness center. If someone's working out and training hard and trying to do everything very healthy, but has injuries, we supply them physical therapy, personal training. Well, they probably also want to look good too, right? So it only made sense to have that all inclusive and all in one place. So to really be comprehensive, we cover the cosmetics. So we have skincare estheticians for facials, laser skincare services, skincare products. We have nutritionists. We do IV vitamin therapy. We do mesotherapy to dissolve fat and cellulite. We do laser resurfacing, cosmetic injectables, and Botox, and Restylane, and Juvederm, and Radiesse, all for cosmetics, but it only makes sense to do it together as, one helps the other. Yeah, I think it kind of does make sense because the people that are working out and trying to look good also really want to look good if they can.
Right.
So certainly it goes well together as the comprehensive wellness approach to healthcare.
In your opinion, Dr. Todd, what do you think are some of the most cutting-edge products that are going to keep people looking youthful for a much longer time period than in the past now?
Well, I think we're just on the tip of the iceberg when it comes to understanding nutrition and dietary. I mean, you hear about antioxidants and supplements, and I mean, there are a lot of ones that really are healthy for your skin and your skin needs you may not get otherwise. So knowing what those things are, like vitamin E and CoQ10 and other things like that, which you can intake, so it makes your skin and other things appear better, like vitamin C, which we know helps collagen last longer. But we're just on the tip of the iceberg of that, and that's a multi-billion-dollar industry that's only growing. Certainly from a medical point of view, I mean, the average lifespan is so much longer, so people are living a lot longer for a lot of different reasons, but certainly better fitness, better cardiovascular fitness, better treatments for chronic diseases like arthritis. And ideally, the best way is preventative care. Taking care of yourself before you have the problem is even better than treating the problem when it occurs. So we're just on the tip of that. And certainly, gene therapy is coming out more and more.
And what exactly is gene therapy? Because I picture a scientist with a little, little dish, kind of petri dish, working out and being like, I'm going to combine these genes and these genes to make you forever beautiful.
Well, it's a really a big term, and it covers several different components. One is testing your genetics to see, are you predisposed for certain diseases? Are you predisposed for Alzheimer's? Are there things I can do to prevent that? Am I predisposed to having diabetes? And if there are genetic tests for that and other things you can do to prevent it, that's great. Then there's gene therapy where a drug targets you based on your genetics, meaning it only targets certain cells based on that. And then you have other treatments that are focused on specifically to alter or eradicate certain problems that are located in your genes. So there's a multifold approach with that. And then you have the whole area of stem cells, which is just in its infancy, which has
very controversial to stem cell research.
Yeah, absolutely, absolutely. But now you can make stem cells from yourself. They can take cells from you and culture to make your own. So you don't have to take embryonic stem cells. You can culture your own naturally. And those are cells. Stem cells basically means it's a progenitor cell. So that cell can be turned into skin, into bone, into cartilage, into anything. So it's a precursor cell that's like
almost like the foundation to what makes us
and you
a
can
body.
make that into anything else. So hey, they're looking at studies where they try to regrow your cartilage in your knee if your knee has lost all its cartilage. They'll focus and target. They put stem cells in there and they're regrowing them. That study is already ongoing in humans in Israel and Italy, where legislation doesn't really prevent them from doing that. So they've been doing that for 3 years, where they did the animal studies already showing it to be effective, and they're already doing it in people. But that can hold true for other organs or other diseases as well. So the technology is really stepping up and becoming much more advanced. And
very advanced.
Yeah, hopefully legislation and other things don't hold us back from doing that, because typically the United States is very litigious, so everything gets here a lot slower than elsewhere.
And do you think with, like you said, the advancements in medicine, do you think that in our society, we do have cures for things, we do have ways to kind of dissolve different problems, but because of the legal system, we don't get to experience the benefits of medical research?
I think we're hampered a lot by that. Just after the 2008 hearings, they really restricted the use of human growth hormone in concerns of those being widely used by everyone as the miracle anti-aging drug. Now, you can only use it now for deficiency or HIV wasting, and deficiency like dwarfism obviously isn't that common. So otherwise, writing it is technically, by federal law, illegal, but it's still being done. Well, it's true your levels do go down as you get older, and could certain people benefit from that? Yeah, probably. They did studies in Europe where people had compound fracture injuries, and they heal 30% faster when they're given it. Fortunately, we're tied here in the U.S. where you can't do that, even though it makes sense to help that person heal faster.
Right.
Well, if they heal faster, wouldn't that be less downtime, less missed work, less medication, less surgery? Yeah, there are a lot of benefits we could have from that, but because of legal reasons, we're kind of tied or hamstringed before that.
Well, do you think that in general we are youth obsessed, obviously, in our culture, and that we keep talking about living longer, longevity, but it's also having a better way of life? But ultimately, we are all mortal. We will all face our maker, whatever that maker is. So do you think sometimes everyone's running away from the facts, and the facts are that we're all going to die, and that cryo-freezing is really ridiculous, that we just need to embrace the fact that no one is immortal and realize that aging sucks?
Yeah, I mean, they should definitely realize there's some mortality to it, and anyone who's selling the quick fix with the anti-aging thing, buyer beware. Why are these things banned in the first place? Well, because in animal studies where they gave human growth hormone to all the animals, what happened? Well, a few of them had unknown cancers. They weren't medically followed. They died quickly. So all of a sudden, it wasn't anti-aging. It was actually shortened your lifespan. Right. So the question is, are you trying to look better now and limiting your life expectancy?
Right.
So those things really have to be used in an appropriate, medically supervised fashion, and can't really just be self-administered, Which unfortunately, some of these things are still easy to get, so people still are using them.
Do whatever they can do.
You see big trends in hormone replacement therapy. If your hormone levels go down as you get older, they try to replace them. Well, your hormones go down when you get older for a lot of different reasons, but there's other concerns about giving the hormones, because could that induce other things?
Right.
Well, if I have some tumor or something, it could make it grow faster. So if it's not like medically supervised, it potentially could be dangerous.
Remember, you can also go to fountainmedicalgroup.com, where you can find out about Dr. Todd's Medical Spa and Center, and you can visit if you need to be seen by a doctor and you're in the tri-state area. You can also inquire about different questions. Dr. Todd, you will answer, obviously, if people have questions or inquiries.
Sure.
He's written for a variety of magazines and publications, so he's definitely accessible and very helpful. Thank you for joining us today.
Oh, thanks for having me.
I really appreciate it.
My pleasure.
And make sure to check out Fountain Medical Spa, or fountainmedicalgroup.com. And thank you again. And hopefully you'll come back soon, and we'll have to talk about a whole nother world that you're also an expert in, which is beauty.
Yeah, a favorite topic. Love to talk about it.
Yeah. Well, thanks, guys, and we'll see you next time. Enjoy the rest of your day.